60 years of homeopathy, a towering field, a towering figure in the field of homeopathy, an expert in materia medica, in the organon and philosophy subject, and repertory, our patron of the Homoeocon Foundation, and without which, whose blessings, this journey would never have been possible. A very, very important person to us, very important to many, many doctors. He has been a principal, he has been a guide, he has held important posts in the Central Council of Homeopathy, in the Central Council for Research for Homeopathy. He considers Dr. Habu his very dear friend. He has always been willing to help us, always ever smiling. Our very dear Arya sir, please help me welcome sir on the stage. It's difficult to choose topics for sir. And finally for 2020 we came to, I told sir, let's keep your topic, let's talk repertory. So I gave sir a wide field to use whatever he'd like to share with us. And I'm sure it'll be an enjoyable experience.
Good noon, friends and colleagues. Before I talk about repertory, in a conference, in one of the conferences, Dr. Gladwin was asked by one of the audience, which repertory, madam, you will recommend? Promptly she answered, one of every kind. This is one story. I'll tell you what is the implication of this. In another conference, Dr. Elizabeth Hubbard was asked, how you study materia medica? She said, very simple. One drug a day, 2 drugs on Sundays and holidays, and 1 drug from at least 3 books. Repertory is a friend, is a philosopher and a guide. It's not a book to be decorated in the bookshelf. The study of drugs through repertory is at the bedside. The study of materia medica from the materia medica is your lifelong exercise. The day you join homeopathic profession, till you go into the grave or you are burnt up, you have to study materia medica. There is no other option. But study of materia medica is a study when you are free. You have no other engagement, no other occupation. You are at relax and then you see. But the repertory study is at the bedside, quickly to prescribe. That means the repertory is the materia medica on your fingertips. Next. No repertory is complete. No repertory is useful or bad. It is the person who uses the repertory makes it good or bad. It's like a instrument in a hand of a carpenter. If you are a good artisan, you can make anything. But if you give a tool, a computer to a monkey, he will make a mess. Right? Prescribing homeopathically is an art which very few people have mastered. Theoretically at least, the homeopathic physician in his work of fitting remedies to the patient seeks totality of symptom. Everybody knows. The totality may be regarded as one of the quantity, that is the number of symptoms of the patient taken together, or as one of the quality, few symptoms which are typifying the patient are to be taken, which are considered as most important. Of 2 remedies which appear very similar to a given case, one may possess a large number of symptoms and apparently numerical totality and still not be homeopathically to the case. Whereas other drug which comes very close, neck to neck in the photo finish, you have a drug which covers few symptoms of the patient, but that becomes a homeopathic drug because that addresses the patient who is sick rather than the sickness. Next. Quality, unquestionably in every field, is always the first consideration, and it leads us to advance further conclusion that symptoms which are most truly represent the patient himself are likely to be those of very high character or quality. Next. We have not yet fully learned the importance of prescribing for the patient and not for the disease. Symptoms which most truly represent the patient himself are likely to be those of very high quality, and therefore the concentration is. This was told to us more than 250 years back by Hahnemann himself. Sure. We still persist in thinking in terms of pathology and prescribing for the diagnosis, although it was pointed out long ago by Hahnemann. Next. The uncommon, the peculiar, the characteristic symptoms relate to the patient primarily and in a secondary sense only to this disease are important. That is the bottom line of homeopathic practice. Next. It is obviously beyond the power of any mind to possess a complete knowledge of pathogenesis of all our homeopathic drugs, but it is perfectly possible to have good working knowledge of most of them by classifying them. If you go to the repertory and try to find out which group of patients we have, we will be able to make use of repertory much better way. I'll tell you how. Next. Mental symptoms, when marked, are of decided importance to the homeopathic physician, and certain broad classification of them are easily borne in mind. Next. It is not at all necessary to delve into the minute distinctions of these mental symptoms, at least not until we come to a final stage where the choice has to be made between the two remedies. When hair splitting differentiation between the mind symptoms is necessary or is required. Broad classification is enough to begin with to arrive at the remedy which is very close to the patient's history. These groups of remedies are quite easily retained in our mind for use and when recalled upon. Next. Yes. Think of repertory, the abusive patient. Those mental symptoms which can be quickly grasped are important to begin with. All right? Instead of asking question and getting reply, that will vitiate the whole mental symptom picture. Abusive people, you see, you need not ask, are you abusive? You can make out it's interaction between them. Abusive people are Moschus, Veratrum, Anacardium, Hyoscyamus, Lycinum, Nux vomica, Petroleum, Senega, Sepia, and in pain, Corellium rubrum. Angry people, Anacardium, Arsenic, Aurum, Brynia, Chamomilla, Hippar, Ignatia, Calicab, Lycopodium, Netramure, nitric acid, Nux vomica, Petroleum, Sepia, Staphylos agria, and sulfur. People who are very maniac and vague, very violent, syphilitic, Belladonna, Hyoscyamus, Calibrom, Lycopodium, Merck, Nux vomica, Stramonium, and Tarantula. If you group your drugs in this fashion, it becomes very easy. People who want to fight are Belladonna, Hyoscyamus, Merck, Sicklecor. Very rude people, very rude. Lycopodium, Platina, Veratrum album, and Cantharis. Destructive people, particularly in young age group, belladonna, hyoscyamus, camphor, cuprum metallicum, tarantula, stramonium. People who are like teachers, censorious, examiners, critical. Drugs are arsenic, sulfur, arnica, baryta, causticum, ipecac, lachesis, nux platina, sepia, and veratrum. You'll find that very few drugs come together and it becomes very easy to retain in the mind if you read. People who are very jealous, hyoscyamus, lachesis, apis, calcarea sulf, centuris, nux vomica, pulsatilla, and stramonium. People who are very envious are pulsatilla, staphysagrija, calcarea, arsenic, lachesis, lycopodium, and sepia. People who are very affectionate, very loving, crocus, ignatia, netamure, pulsatilla, anacardium, coffea, platina, phosphorus, sinega, veratrum. People who keep on kissing and hugging each other are again cockroach, veratrum, capsicum, phosphorus, and stramonium. Next. People who want to be magnetized by others, calcarea phosphorus, lachesis, and silicia are the people who would require constant attention. People who are very sentimental, antimony crudum, ignatia, calcarea cocculus, coffea, cuprum metallicum, phosphorus, surinum, and sulfur. People who are very suspicious, aconite, arsenic, baryta, brynia, cannabis indica, causticum, digitalis, kali arts, lachesis, lycopodium, pulsatilla, rustox, stramonium, and sulfur. You can add with your experience any number of drugs. Basically, I found that these are few which will cover most of your cases. Next. Sad people, depressed people are aconite, arsenic, aurum, calcarea, carboenemalis, causticum, chamomilla, simicifuga, ferrum, geranium, graphites, Helleborus, ignatia, iodum, calibrom, califos, leccaninum, lachesis, lycopodium, murex, netramure, phosphorus, surinum. Surinum and pulsatilla. Weeping people, pulsatilla, calcarea, apis, causticum, cicuta virosa, ignatia, lycopodium, netamure, palladium, sepia, and sulfur. Frightened people, people who are frightened easily, are argentum nitricum, arsenic, baryta, borax, graphites, lycopodium, natrum ars, natrum sepia, and kali. People who are hurried in everything, they want to do 2 things at a time, 3 things at a time. Lilium tigrinum, medorinum, myrrh, natramure, sulfur, sulfuric acid, tarantula, cubensis, argentum nitricum, arsenicum, and ars iodide. Also, baryta, ignatia, iodum, kali, lachesis, and nux vomica. Can I have another say? Yeah. Coming on the physical plane, you have number of people who can group together. There are people who are affected very much by seasons and the weathers. And these seasons and weather changes affect in many various ways from mind, head to toes. Many are worse in wet weather or damp weather and may therefore be so called, so classified. Next. There are some people, however, seem to be capable of their best work and whose symptoms are actually better in wet weather, or in other words, those individuals may be classified as patients who are worse in the dry weather. Next. For them, it is easy to remember that an all-wise nature has provided remedies also, and these are listed in our repertory. A good general repertory contains all these points which I am talking about. These are Asaram, Causticum, Hipparsulf, Nux vomica, and Kalika. Again, some of our confiding patients are extremely sensitive to cold winds coming from north. And here we have naturally bring to our mind the drugs like aconite, arsenic, belladonna, chamomilla, lycopodium, nux, phosphorus, pulsatilla, and rhododendron. Of these, aconite and nux at least are aggravated by dry wind, whereas rhododendron goes into the class of stormy and wet weather winds. Next. Injuries provide number of drugs. Injuries provide opportunities for homeopathic triumph, and the common wounds which everyday life is exposed are easily separated into certain groups of classes. Hence, contused wounds suggest arnica, quinine, and sulfuric acid. Since quinine may at the same time be placed among the glandular remedies, it would seem to be related therefore to contusion of glands. That is what we find in repertory and in materia medica. Lacerated jag wounds remind us of calendula is needed, while puncture wounds require ledum pal or hypericum. The latter is so extremely painful in its manifestation that wherever their nerves are involved, the pain is very severe, and irrespective of what part is injured and which other organs are damaged, if you have this sensitive nerve injury, think of hypericum. Next. Bryonia and rustox affect the tendons and ligaments. Also, the muscular tissues, all the three types of muscles, voluntary, involuntary, and even cardiac. While on skin, let me also remind what repertory suggests for abscess formation. Belladonna, Hipparsulf, Lachesis, Merck, and Cilicia. Of course, the repertory also suggests many other drugs. If we group these few remedies in this fashion, it will aid us in the differentiation between them at the bedside. Next. Of course, there are many other remedies in materia medica, but these are some of the commonly used medicine if you go through the literature. Next. Sweats is another differentiating feature for differentiation of drugs, particularly foot sweat. Abnormal foot sweat, especially those of foul odor, trouble many people. The homeopathic physician regards them as the manifestation of some constitutional dyscrasia. But whether we agree with him or not doesn't make any difference. But if you have a sweat which is offensive, think of some very few remedies which are given in the repertory taken from out of materia medica. Next. Vereticab, graphitis, Kalicarb, petroleum, surinum, pulsatilla, silicia, sulfur, tellurium, and thuja are the drugs which are having offensive not only food sweat but over the body odor. There could be many other. There could be many other which can be realized by you, but then slowly by experience you may be able to add more and more as you go on in practice. Next. A warm room distresses many beyond endurance and necessitate a hasty departure to the cooler place, open place. Right? Such patients require perhaps one of many remedies whose selection is not dependent upon his distressing circumstances alone, but whose choice may be facilitated by classifying according to the following groups: apis, calcarea sulf, graphitis, iodum, kali iodide, kali sulf, lycopodium, pulsatilla, sabina, sickle cot, senega, and sulfur. Quite an imposing list, but still very short to remember when it is needed. Next. In some diseases, patients are always worse at night. And although many remedies show similar modality, a small group of important ones are readily retained for use whenever required. And these drugs are aconite, acerum, chamomilla, china, ferrum metallicum, hyoscyamus, Kalicarb, lachesis, murk, nitric acid, phosphorus, surinum, pulsatilla, rustock, silicia, and sulfur. This list may appear very long, perhaps, especially to the beginner. It is easy to disregard some of these remedies if you don't want, but keep in mind these drugs because you may require at some or other time at the bedside. But as you go on in practice, you will add more and more drugs rather than reducing these drugs. Next. Some diseases have affinity for affecting one side only, either it's a right side or left side, or some they migrate from right to left or left to right, from upper left to lower right and upper right to lower left. All these are important because they individualize the patient and not the disease, and therefore they are highly important. Diseases frequently affect one side of the body more than the other. The patient often experiences all of the painful symptoms on the right side or the left side, where the location of the symptom depends on the underlying organs such as liver on the right side or the spleen on the left side. You call certain group of drugs. Think of, in this condition, belladonna, bryonia, chelidonium, lyco, magnesium muriaticum, murk, and nexomica. If the right ovary is affected, then you have drugs like apis, palladium, podophyllum, etc. On the other hand, a few prominent left-sided remedies are lachesis, phosphorus, sepia, and stannum. Next. In the throat affections, we may again classify according to the sides, and also so much simplifies the task of choosing a remedy quickly, particularly in acute phenomenon. Belladonna, lyco, murk, and murk IF, iodatum flavum, are the right-sided throat remedies, whereas lachesis, murk, iodatum rubrum, naja, and sepia are the left-sided in their manifestation. It's easy to remember. Keep more and more, if you remember, less and less you will make use of repertory. But if you don't remember, the best course is go to Repertory and, and see. Don't prescribe unless you are very sure for a patient, because it's a question of his survival and relief. From this consideration, it is an easy step to recall that lachesis begins on the left side and extends to the right side in almost most of the complaints, whereas lycopodium elects to produce symptoms on the opposite side from right to left or right side, settling down on the left side. Leg caninum, like from the animal which it has come, derives jump from one side to other side. Right? Sleep, another important differentiating feature. Some cases are always relief after sleep. They appear to gain vitality and thus feel better in every way. There are remedies which correspond to such condition of increased well-being, and these are murk, nux vomica, phosphorus, and sepia. Especially phosphorus after sleep is much better. Yet there are other cases which are aggravated after sleep, and when this situation occurs, or when we see the drugs like lachesis, opium, selenium, spongia, stramonium, and sulfur should be thought of. Next. The position of the patient, the decubitus, what we call, varies according to his ailments, the organ or the organ specially involved. He naturally seeks the position most comfortable for him and soon finds the other are out of question. Remedies do similar things and can therefore be classified according to such position, like belladonna, colocynth, medorinum, stramonium find comfort in some condition of illness, at least by lying upon the abdomen. Nux vomica, phosphorus are worse lying on the back. Kalikab, murk, and stannum are worse when lying on the right side, whereas phosphorus, pulsatilla, sepia are aggravated lying on the left side. There are a few other, of course, such as aconite, cactus, natrum sulph, thuja, and these may be added as we become more and more familiar with our materia medica. Next. Patient may again be divided into groups symptom according to the motion, whether they are better by motion or they are aggravated by motion, whether they are aggravated at the beginning of the motion or continuous motion or at the fag end, or slow motion and the fast motion. Right? All these are important because they typify the patient. Belladonna, irrespective of the disease which they come from. Belladonna, Bryonia, Chelidonium, murk, nux vomica, ranunculus bulbosus, sabina, silicia, and sulfur are important drugs to be considered. Next. Remedies whose symptoms are relieved by motion are conium, cyclamen, dulcamara, euphorbinum, ferrum, kali sulph, lycopodium, pyrogen, pulsatilla, rhododendron, rustox, sulfur, and valerianum. These are the principal ones, and although there are many others, you will notice that sulfur stand in each group. And we may recall that sulfur, when at rest in the standing position, is greatly aggravated. So you will find him sleeping by motion or really by motion or ameliorated by motion. Next. The desires and the aversions, which are very well marked, are important because they again point out the patient who is sick rather than sickness. The desire and aversion of the patients as they related to food and drink may be helpful in classifying in a convenient manner these patients without greatly taxing our memory, and inordinate craving of sweets would suggest argentum nitricum, china, lycopodium, and sulfur. To be sure, there are numerous other, but these are of the highest rank in any good general repertory, and in any given case, it will require quickly seen whether they are apply or not. Don't depend only on this. This will be only a opening. Rest of the symptom, rest of the concomitant modality and location, etc., are to be covered. But these will be only entry points. On other hand, where the patients prefer sour thing or acid, these are some of the drugs: antimony crudum, corallium rubrum, ferrum, hiparsulf, natramur, sepia, and veratrum album. When we treat women, it often facilitates if we remember their menstrual history, menstrual function. The character of this type function typifies the woman herself rather than her uterus or the ovary or the adnexus. All right? They are among many other given repertory, although less value. But these are important symptoms. Keep in mind whenever you are treating patient. Next. What are they? They are arsenicum, belladonna, bovista, calcarea, cocculus, cyclamen, ferrum metallicum, ipecac, calicap, natramur, nux moschata, nux vomica, phosphorus, pulsatilla, rustock, sabina, and sickle core. Have early as well as copious menses. And on one hand, we have these drugs. On the other hand, we have causticum, conium, dulcamara, graphitis, calicap, lycopodium, megcarp, natramur, pulsatilla, sepia, and sulfur, who have menses which are late. I'm sorry, which are late and scanty. Next. Causticum, conium, dulcamara, graphitis, calicap, lycopodium, megcarp, natramur, pulsatilla, sepia, and sulfur have menses. I have not yet finished that. Thank you. Menses which are late as well as scanty. Right? Next. Menses which are both late and profuse are likely to find remedies in one of the following groups. Which are they? Carbolic acid, causticum, kali iodide, calicap, phosphorus, and silicia. Kali iodide also has greenish, sud, profuse expectoration in bronchiectasis and in the late stage of asthma. Right? Cor pulmonar. Next. Remember, concomitant symptoms will confirm these drugs. Don't depend only on these symptoms, but have the rest of the symptoms should match with the drug which is given here. It will be seen, therefore, how much the knowledge of such group of remedies pertaining to characteristic symptom enable us rapidly to form mental combination of drug picture and eliminate unlikely remedies from the choice. Next. Friends, such grouping of rubrics can easily be made for the personal use. Which repertory is best? That repertory is best which you make for yourself. All these old repertories were made by the masters of materia medica for their own use, right? And therefore they are worth gold, and they are to be read again and again. Whenever you have free time, keep on shuffling the pages after pages. Something like this you can collect. These grouping can then be expanded almost indefinitely as your experience goes. You must make your own repertory that suits your requirements, your working, and your personality. You search for a similar remedy quickly in this manner. I find it suited for my temperament and for my search for the remedies whenever I require. Next. Thank you. If you have any question, you ask me.
Thank you, sir. Thank you so much.